Dr. Joel Simmons here from Ohio Herbal Clinic. I am very happy and pleased to be here today at the Botanist Dispensary in the Arena District. We have Pharmacist here, Dr. Ronnie Cineroy, and he's agreed to spend some time with us and cover some important questions. Thanks for having us, Ronnie.
How you doing, Dr. Simmons?
Doing good, doing good. So a pharmacist, you're on staff here at the dispensary. Is that a state requirement? I didn't think a lot of dispensaries had pharmacists on staff, so can you just tell me a little bit more about that?
Sure. So I actually came from New York, where having pharmacists dispense medical marijuana was a requirement.
Okay.
So when states are designing their programs, they choose, should we have pharmacists as a requirement to dispense medical marijuana, or should we not? There are a few states that have said, we want pharmacists on staff if medical marijuana is being dispensed. New York's an example, but there are others. Minnesota, Connecticut, Pennsylvania. These are some examples of states that have said, we mandate pharmacists on staff to dispense medical marijuana. Ohio, when they were drafting the legislation, considered it. Some groups wanted it, some groups didn't, and they ended up saying, you know what, while it is medical marijuana, we're not gonna force a company to have a pharmacist on staff. I think one reason is because the argument is it reduces patient accessibility. Pharmacists might command a higher salary than typical backgrounds that run a dispensary, in which case they thought that an additional cost would be passed on to the patient. Another argument also is because medical marijuana isn't an FDA approved medication, you don't necessarily need a pharmacist to be on staff to dispense it. That didn't preclude from a company in Ohio, though, from choosing on their own, even though a pharmacist isn't mandated. We really understand the health implications of medical marijuana and want a healthcare professional on staff.
Gotcha.
To help patients.
So you gotta, interpret that as an attempt to provide better quality care.
I'm a little biased, but yeah, I believe so. I think there's a lot more to cannabis than people know. There's a very heavy research component to it. There's a lot of compounds in cannabis that we're still trying to figure out how they function within the body. There's drug interactions with cannabis. Certain conditions need certain substances in cannabis more so than other conditions. CBD is an example. If you have heavy inflammatory conditions or spasticity, you might want to increase your CBD content. But there are other conditions that may rely more heavily on THC. So, and this is just the tip of the iceberg. I mean, what we're gonna find out and discover down the road once research expands, once legislation ruins and reschedules cannabis, we're gonna find out a lot more about it and its potential health benefits and concerns. So there's a lot of aspects to medical marijuana that are very similar to when you go to a traditional pharmacy and how you administer the product. Another aspect of it, right now the medical marijuana program is being governed by the Board of Pharmacy. Obviously, when it's being governed by the Board of Pharmacy, a lot of the legislation and the rules and how they want the dispensary to operate is very similar to a pharmacy. So it only makes sense to have a pharmacist on staff, so you make sure everything is meeting up to code when you run the dispensary.
Gotcha. So I can imagine some of your duties are probably administrative, but then you're also clinical day to day. So how are you from a clinical standpoint with patients coming to the dispensary, interacting with the staff? Can you tell us a little bit about your position and function within the actual dispensary?
Sure. So every company can choose, if they decide to have a pharmacist on staff, how to implement that pharmacist. So a dispensary could very well say, listen, we understand your background. We want you only to deal with the clinical aspects of cannabis. Another dispensary company could say, we want you more for the regulatory side of things. And then another dispensary could say, you know what, pharmacists they have experience managing, we want you to handle the business side of things. So depending on how the company wants to utilize that pharmacist, they can obviously, do so. I like to think now I'm no longer a pharmacist. I just happen to be someone that manages a medical marijuana dispensary that also is a pharmacist.
Gotcha.
But there also could be a dispensary that said, no, we want you to stick to your role. We only want you to handle the patient care aspect of it. what I like about my role here is I'm handling not only the patient care and trying to implement some of the clinical programs that we're trying to do at the dispensary level, whether it's research, patient consults, really education for not only my staff but the patients as well, but also overseeing the regulatory side of things and the business side of things. And it really gives me not just one hat to wear, but multiple hats. So I guess the short answer to your question is, however the dispensary wants to use that pharmacist based on their skill set is how they use them.
Okay.
Yeah.